Since the 1960s, cardiovascular disease mortality has been declining in the US and high-income countries, and it's been a sustained reduction, contributing to improvements in life expectancy. But since around 2010, that trend has changed in the last couple decades, and now what we see is a deceleration in cardiovascular disease mortality improvement. The proportion of deaths due to obesity has really changed over time. If you look at the proportion of obesity-related cardiovascular deaths, at the beginning of the historical period in 2003, it was around 38% of the total. But by the time you look at the end of the period, it's over 50%. And that's true for both males and females. So generally, when you're looking at the cardiovascular disease mortality over the period, and you're looking at that by the obesity status, the individuals who have obesity generally have a higher cardiovascular disease mortality than those individuals who are non-obese. When you're looking at the education level, the low education group, and low education in our study is defined as individuals who do not have a high school education. Those individuals have the highest cardiovascular disease conditional probability. The middle education group, the mortality is a little bit lower than the low education group. And then the individuals who have the best cardiovascular disease mortality, meaning the lowest, are the highly educated individuals. And what we see over time in these groups is a widening of the gap. Over that period, that the mortality has deteriorated more quickly in the low educated group versus the high educated group. Well, the forecast of the trends to 2029 really is not good. It continues the trend, the historical trends. The research didn't look at the impact of GLP-1 drugs for weight loss. So there are things that definitely could change the trends that we're seeing, but there's a continued divergence in cardiovascular mortality trends between the obese and the non-obese populations across all education levels. That's similar to what we saw in the historical period. And then again, a continued increase in the widening of the gap between the education levels, the socioeconomic impacts that we're seeing. It just continues to widen in that period. The research that we did and looking at the mortality trends, both historical and what the future may hold, definitely can help life actuaries and health actuaries. One way that it can help life and health actuaries is with underwriting. Understanding the trends and patterns in premature cardiovascular disease mortality definitely can help them with risk assessment and managing the strategies. Also, too, obesity is a common risk factor. Understanding the effect, especially given one's education level, can really help actuaries and underwriters with risk management. The results of this research can also help life insurers and health insurers refine some of their wellness programs and provide insight into, I would say, what needs to be tweaked in their programs and how obesity plays and education play a role in those programs. So that's another benefit, I think, of the research for the industry.